Hello, Mrs. Smith. I'm so glad you decided to start Invisalign, and I just want to kind of show you what it's capable of. I found a case similar to yours, and I want you to see this lower crowding, and you can see how the teeth are quite rotated. This one's going this way, this is like this is like this. And then at the end of this was about 10 months, look how beautiful the teeth look. Doesn't that look nice? Oh, yeah, that looks really good. That was only 10 months. Great. I want you to notice something, Mrs. Smith. You see how this tooth right over here is just a little bit rotated in, or actually not a little bit, quite a bit. And you see right here, it's still very slightly is set back if you look at the way those two teeth line up. Oh, I barely even noticed that. That looks fine. And the reason for this, Mrs. Smith, is that Invisalign is very effective, very efficient, but the aligners are directing and guiding the teeth. And sometimes you have to do a few rounds of aligners, but each one is less than the round before. And this was only 10 months. And I think this is a great result. But I do want you to notice that this patient's happy, even though this tooth is just slightly back. All right, now, what did I just do? Here is maybe the most critical point that any orthodontist or Invisalign provider, especially pay attention orthodontic residents, needs to message from the start of Invisalign treatment. And here's the deal. So if you had braces on this person and they started treatment, and the patient probably would notice throughout the treatment the teeth were getting straighter, but they really weren't looking beyond the metal and the wires, and you took the braces off, they would be thrilled to have them off and love these teeth. But this particular patient was an Invisalign patient, and we have done a few rounds of aligners, and this patient is still concerned because this tooth, he says, is still not straight. And this can be frustrating. Here's the deal, though. I think Invisalign is held a little bit to a higher standard because if you removed braces, let me just tell you, if this case was treated with braces and you remove the braces, the average orthodontist would have some little discrepancy, maybe not right here, but at some area that nobody would see. It wouldn't be a bad result. It wouldn't be an incomplete result. It would be a great result because teeth have different thicknesses, different wear patterns, and sometimes it's just hard to get it perfect. Getting this tooth a little bit straighter like that does not make the case more stable. It is not a functional advantage. It's not a hygienic advantage. And it's not even an aesthetic advantage because if we do indeed make this tooth go from here to here, it will look no different. Now, if you do one round of aligners and it's only been 4 or 5 months, you certainly would get another round of aligners. But when you've done a few rounds of aligners, sometimes you can spin your wheels and have a situation where the tooth is still not perfect. Now, orthodontists, you may be thinking, hey, if I had brackets and wires and it was the D-band day, I may pause the D-band, tell the patient they needed another month of treatment, and I might put a little bend in the wire. Well, guess what? I've done that for years, and sometimes it works out perfectly. And sometimes you make that bend, and now you have the tooth out too much. It is not an exacting science, braces, and Invisalign is very effective. Now, I'd like to get the teeth to look like this, but the patient has been at this for a while. Their compliance has been good, but not great. And this will be what I tell the patient should be the final result. And so one thing you can do to give patients illustrations of this is print out a model of the teeth in a case you have where your result was 98% aligned. And let the patient hold it and touch it and see it. And I'm telling you, if somebody saw this before and after, like in my reenactment at the beginning of the video, they would say it looks great. And you have to then point out the slight issue, and then you come back to it at the end of their treatment and you say, remember in the beginning, we tried to explain to you that you could run your finger and still feel a little something that's a little bit out of place. Now, if the patient insists on getting more aligners and they've already been at this for a while, and maybe they have been losing their compliance because sometimes you love how your teeth look and you're kind of getting tired of the aligners and you don't wear them enough. Well, if that's the case, you may have to charge additional fees, and that's something you can put in your contract in the beginning of the treatment. So hopefully this is a good video to explain how to give graphic illustrations of before and after cases to manage before and after result expectations.